There's much controversy about wearing a mask. What's your take?
Well, with the single exception of the horrific failure to protect the most vulnerable in our society, I've avoided judging political leaders for their policies regarding the coronavirus. It was a new disease. We knew little about it. And the information from the experts was mixed and constantly changing. So many wrong decisions were inevitable, especially because of the conflicting advice from the science on the use of masks. And there's been very little reporting on the history of that advice. So I did a little research. We are repeatedly urged, usually sanctimoniously, to follow the science. And after I've read through my own research, I have the question, from where and to where? The difference in the changing scientific information is mind-blowing. I mean, you could go out and shoot crap and come up with a better percentage than they have. And one of the first advisories about masks came on January 30th from the Centers for Disease Control and Prevention, the CDC. It did not recommend the public use of face masks. And according to Vox, the publication, in February, CDC Director Robert Redfield said there's no role for masks in the community. And Surgeon General Jerome Adams said, stop buying masks. They are not effective in preventing the general public from catching coronavirus. And then on March 8th, Dr. Anthony Fauci, director of the National Institute of Allergy and Infectious Diseases, said on CBS 60 Minutes, there's no reason to be walking around with a mask. A week before that, Market Watch reported that the CDC, the U.S. Department of Health and Human Services, and the U.S. Surgeon General advised that people shouldn't wear face masks to prevent the spread of the infectious illness. And Dr. Amish Adiola, a scholar at the Johns Hopkins Bloomberg School of Public Health, applauded the CDC's recommendation. He said even during the H1N1 flu epidemic, there was no recommendation to wear face masks. And like the CDC, the World Health Organization, WHO, advised people to wear a mask only if they are displaying symptoms of coronavirus or taking care of a person with suspected infection. Earlier, Dr. Nancy Messonnier, director of the National Center for Immunization and Respiratory Diseases, said, "We don't routinely recommend the use of face masks by the public to prevent respiratory illnesses. And we certainly are not recommending it at this time for this new virus." Then a bombshell. In April, CDS completely reversed its position and urged the public to wear masks. Although the news media largely ignored the total change of the science, Vox did comment, a remarkable shift for the United States to move toward mandatory masks in the span of just a couple months. Amen. But the scientists continued to supply totally contradictory information. On May 29th, at the end of May, almost June, ABC News reported the World Health Organization's guidance about when to wear a face mask may seem confusing to Americans who have been advised by the CDC to wear masks. But WHO guidelines still read, if you are healthy, you only need to wear a mask if you are taking care of a person with COVID-19. Fortunately, Dr. William Schaffner, the medical director at the National Foundation for Infectious Diseases, explained the contradiction. Quote, advising universal mask wearing could hurt WHO's reputations in some countries. A lot of public health is how can we take the theory and the science and bring it down to the average person. Public health has to be practical, otherwise it doesn't work. Are we to understand that scientists sometimes lie deliberately to us average folks? Incredibly, only 2 hours after I finished taping my commentary on the total contradictions that we've gotten from the science about the use or non-use of masks, 2 hours after I finished doing that, the science, this time the World Health Organization, announced that lockdowns don't work.